Oh. Welcome, welcome, welcome in everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything that we do. We enjoy the opportunity to meet folks from all walks of life, and with each of them regarding their situations, we educate them about what lies ahead and what their specific options are, given their financial and medical status. Our services are free, and in the same vein, we offer free CEUs. Hello, Stephanie Durzis. Thank you for being here today. We offer free CEUs. We're accredited by the boards of social work examiners as well as nursing practitioners for the state of Alabama. Each of them give us the ability to create, credential, and post these hours for social workers and for nurses. Those of you who've been with us before know that we have an evaluation process that we must go through if we want to receive credit for this contact hour, and that evaluation is password protected. So I've posted in the chat room the link, which I will read in just a moment. And as y'all know, who've been with us before, the password we give out about 1250, 1255. And then using that, you access the evaluation once complete. This evening or in the morning, I will send out your contact hour, and by the end of the week, we will have posted any nursing hours to the ABN website on the behalf of any nurses on the call. Welcome those of you who've just joined us. It's Care Concierge with Care Patrol, where education is the heart of everything that we do. You know, Care Patrol is sort of like the marriage of real estate and social work, we like to say. So we end up doing a lot of discovery work and assessment, clinical and otherwise, for our clients. But then we also do some services like a realtor might, which is refer other entities like lawyers, for example, who can be of help. And we do so at no charge to our clients. So if a realtor shows you a dozen houses and you elect not to buy one, then she has worked for free for you. And the same is true for Care Patrol. We're going to share information, we're going to educate you, but we're going to leave the decision to you. We're not salespeople. We're people that prefer to serve. And if we can serve you by helping you find a place, great. If it's not in the cards for us right now, that's great too, but we're always free. Welcome to those of you who've just joined us. This is Care Concierge with Care Patrol. We are accredited by the boards of social work and of nursing to provide these contact hours. And our survey, I'll read now to those of you who may be listening by phone or otherwise are unable to see a screen. I want to read to you today's evaluation password. It is https://www.surveymonkey.com/lowercase r/ all uppercase letters with some numbers as well, 7756 QS D as in dog. Again, I'll read this evaluation link to those of you who are making note of it. It's https://www.surveymonkey.com/lowercase r//7756 uppercase Q, uppercase S, uppercase D. Ms. Whitted, I am now putting it into the chat per your request. And remember that it is password protected. The evaluation will be giving out the password a little later. We're so pleased today to have a friend and colleague who's offered to present for us what I believe will be a very personal as well as a clinical talk and journey for some of you perhaps who may be in the same vein of thinking or of a illness or wellness state. Dr. Brown is a celebrated speaker. And we were so pleased when she agreed to join us and to share her expertise with each of us and with each of you. And so without talking further, as you all know I like to do, I'm going to allow Dr. Brown to begin her presentation, and with my deep felt thank you.
Well, thank you so much. I appreciate that, all the kind things that you just said about me. Hello, everyone. Dr. Kwajalein Brown, and I will present for your knowledge and consideration the great imitator, living with lupus and how it affects mental health. I want to go ahead and say up front that I'm an ambassador for the Lupus Foundation of America, and this presentation is for clinical, mental health, and educational purposes only. All right, so this is me, and I want to tell you a little bit about what qualifies me to present to you today. I hold several applied health bachelor's degrees from the University of Alabama, a doctorate from USC. I have over 15 years of experience in mental health and applied and direct care healthcare. I currently work for a major health insurance company providing brief intervention therapy to chronically ill patients. I am the owner of my own private practice. And last but not least, I'm a lupus patient myself. I was diagnosed in 2009, although I believe I've had symptoms for several years before then. And since being diagnosed, I've experienced a stroke, hair loss, chemotherapy, excessive weight gain, kidney function decline, and a host of dental, neurological issues, vision loss, and hearing loss. And here are a couple of pictures to kind of prove what I'm talking about. This is what lupus looks like. So research indicates that 63% of Americans surveyed say they have no idea what lupus is and has little knowledge about lupus. Lupus is a disease that occurs when your body's immune system begins to attack its own self, so its own cells, tissues, and muscles, and it sees your own personal body as a foreign invader, and it causes inflammation and severe damage to otherwise healthy cells and tissue. So the inflammation caused by lupus can affect many different body systems, and it can be difficult to diagnose because the signs and symptoms often mimic other diseases, and hence that's why it's called the great imitator. The most distinct cause of thing that you can see on the outside about lupus is that most people have what we call a malar rash, and it's a rash that goes across the nose and the bridge of the cheeks, and it's usually red in color, and it resembles a butterfly. Okay, so here's a snapshot of the signs and symptoms of lupus. It can present itself in a variety of ways, and most commonly is affected by your skin and your joints, major organs like your kidneys, your heart, your blood vessels, your blood cells, brain, and your lungs. Two causes of lupus. There are no two causes of lupus. Everybody has different reasons for why their lupus manifests itself. And those signs and symptoms can begin suddenly, or they can develop slowly and be on a spectrum of being mild or severe and maybe temporary or permanent. Most people with lupus have disease characteristics of what we call flares. Those are signs and symptoms where they may get worse at sometimes, and then they improve, or they disappear, and then they come back. Signs and symptoms of for lupus patients will depend on what body system is being affected at that time. And the most common signs and symptoms are things like fever, fatigue, and joint pain. Inflammation usually happens when your immune system is fighting an infection or an injury. But for lupus patients, it occurs when the immune system attacks, like I said, healthy cells, causing swelling and pain. And research tells us that people have an inherent predisposition for the disease, and it's likely lupus results from a combination of a genetic and environmental factors, things like sunlight, injuries, and infections, and sometimes medications. So here's my little dark humor that in the lupus world, we say that it's Sparta, and it's a joke, but that our bodies are always at war with itself. So lupus is most common in women and is usually diagnosed between the ages of 15 and 45. And it's most common in African-American women, Hispanics, or Latino, and the Asian community. I was diagnosed at 27. I have more than one connective tissue disorder, an autoimmune disorder. I have 15 siblings, but none of my siblings have the lupus diagnosis or any autoimmune diagnosis for that matter. I do have extended family that have an autoimmune issue. And I have one experience where I had a childhood friend that was a lupus patient, and she unfortunately lost her battle with the disease. So still talking about how lupus presents itself in a variety of ways. And like I've said, it mimics all different other types of conditions that you can see here. Many different systems and organs are affected. And you will find that patients have, kidney damage and kidney failure, and nervous system issues can be affected. Patients may experience headaches, behavioral changes, vision loss, strokes, seizures. Many people with lupus experience memory problems where it's difficult for them to express their thoughts. And then there are issues with their blood where they may be anemic and have blood clots. As far as lungs are concerned, we worry about inflammation of the chest cavity and pleurisy where they're not able to breathe or have pneumonia. That's a big problem about this time of year for lupus patients. Pericarditis or problems with your heart and your cardiovascular system. And one of the most important things that is preached to me by my rheumatologist, and that I preach even to this day, is infections. So your skin is your biggest organ. And so what you want to do is protect your body as much as possible, but any foreign invaders from getting in. So if I get a cut, I immediately wash my hands, put peroxide on it, put antibacterial cream on it, because that is a #1 indicator of starting a lupus flare. And neurological symptoms, again, like tremors and neuropathy, or vision and hearing loss, or decrease in vision and hearing. Lupus patients on average see about 10 doctors before they receive a diagnosis. 1 in 3 lupus patients suffer from multiple autoimmune diseases. And on average, person takes about 8 prescriptions. At one time, I was taking 20 different medications and chemotherapy, and was admitted to the hospital about 10 plus times for about 3 to 10 days at a time. Most used medications for lupus patients are off-label usually, anticoagulants, anti-inflammatories that we use over the counter, but there are some that are used off-label. Say for instance, the blood pressure medication I can think of off the top of my head. And last but not least, our double-edged sword is steroids, or corticosteroids, that help bring down or suppress the immune system, but they also have a effect of where now that your immune system is suppressed, you're more susceptible to having other complications. Okay, so I like House, and one of his famous things that he said on his show was he was a diagnostician, a fictional diagnostician, and he would always tell his residents, it's not lupus. Whatever it is, whatever the phantom symptoms were, it's not lupus. But think about it in your own life. There's something going on with you. You can't put your finger on it, and your doctor is telling you you're fine. You know, it's in your head. Drink some more water, get some more rest, maybe get some herbal tea, or eat more whole foods. So let's begin by painting a picture with living with lupus. It can have profound effects on your self-awareness, your self-worth, your mental health and well-being. Patients likely experience grief, fear, anxiety, and depression, and likely is light. We do. And patients have a difficult time concentrating and sleeping. The visual manifestations of lupus, the rashes on your face, you may have a different gait, meaning you're walking different, you have swollen joints, you've gained weight. You need an assisted device. Like I myself had a walker at one time, and I used to walk with a cane. It takes a chip at your self-esteem and the way other people view you and your health and how you view yourself and how you thought, in your mind, you used to be one way and you used to be so healthy. And now, you're at the rheumatologist's office and you have a cardiologist, and there are a lot of people in there that are a little more seasoned and aged than you are. And then you start to be concerned about your appearance, and then you become withdrawn. The pain and fatigue and other symptoms can make it difficult to perform even the smallest of tasks. Simply living with lupus, there's pain and fatigue and those everyday wear and tears on your psyche and your body can build up and make patients feel very hopeless. It may become necessary for them to cut back on their community obligations or work or leave their employment. And then sometimes, they have issues with income and the ability to financially take care of themselves and their families. And so that chips at the patient's sense of purpose and self-worth. And then there, and when you're thinking about that, that's depression. Let's talk about social isolation, and how they have to expend a lot of energy to get through the day. So sometimes you have to kind of weigh, do you really want to go to this Christmas party as opposed to, preparing a meal for your family? So sometimes social activities are the first things that are cut out of patients with chronic illnesses routines. As a matter of fact, 76% of patients with lupus say fatigue limits their ability to participate in social activities. And they find that they're have difficulties within their family systems. Disease activity can make it difficult to take care of their homes and to take care of their little ones. And then there may be family strife because, you may look okay and your family is saying, well, you're saying you're tired, but you look fine. And they don't understand. So then there's this push and pull and division and animosity about whether or not your loved ones actually believe that you're going through what you are. And then, of course, there's uncertainty about your future. Having a chronic, unpredictable illness can cause doubt and begin to be stressful. And you wonder how the disease will progress and will you be able to be independent during this time and manage physically and financially? And sometimes even wonder, is this disease going to take you out and will you die? The interpretation in the way of life and is frustrating amongst most patients and their families. 94% indicate that lupus interferes with their everyday life and enjoyment. 89% of patients that are working say it impacts their working life. And 55% of those people surveyed report that they've had to cut back to part-time or being unemployed because of the disease activity. Or that 1 in 4 patients actually currently receive disability, and that it's a burden on their family. It's a major blow to their financial ecosystem of their family. 60% of lupus patients note that it takes 16 hours or more of their week to prepare and anticipate any roadblocks that could occur during the week, meaning their mobility, how their travel, childcare, who's going to take care of their kid if they get sick, or who's going to fill in for them if they can't go to work. 75% of caregivers surveyed say that they help a loved one with activities like bathing, cooking, and shopping, household chores. And I can personally tell you that my husband has had to help feed me. There have been times where I haven't been able to feed myself, or I've had a good best friend of mine who's left her home. I'm sure she had other things to do, but she's come to my home and I couldn't lift my hands to feed myself or comb my hair, and she's done that for me. So when we're also talking about this, let's talk about women's health issues, because there's an increase for miscarriages, high blood pressure during pregnancy, preterm birth. As a matter of fact, I have experienced all of these things. I had my son 3 months early. He's now 7 and doing great, but that was a scare, and I stayed in hospital a good amount of time. It's recommended that you work along with your rheumatologist and your OBGYN to kind of plan your pregnancy. So, usually when you're planning pregnancy, it's between, yourself and your partner. But when I got pregnant with my son, it was between myself, my partner, my rheumatologist, the OB, and a couple of other people that probably shouldn't have been in the room. Well, they weren't in the room, but in the conversation, should I say. And when we're thinking about men and their difficulties with lupus, there is a such thing as sexual dysfunction and ED and sterilization that happens where they may not be able to procreate at all. Cognitive and behavioral health is most helpful when it's measured on a barometer. So it's kind of like, are you in the green or green for go, or are we kind of in crisis here? And many people experience a variety of related complications and indications. As many as 60% of people with lupus will experience some type of memory issue, like recall of dates and appointments, lack of clarity. And so that's what we're calling lupus fog in the lupus world. And these problems often coincide with periods of increased disease activity. And then there's anger, there's anxiety, and there's depression, are the most prevalent mental health issues that occur in this world, where most doctors, primary care, will suggest that you take some type of, call it a 2-for-1, where it helps with your depression, but it also helps with pain. Cymbalta is one that's usually used. Rheumatologists, it's up in the air with rheumatologists. They're really trying to calm down the disease progression. Patient surveys say they feel like 85% of their issue is anxiety, 90% of their issue is depression and grief and the feelings of unknown. 94% of patients experience increased anxiety and depression, stress, worrying about their families. But lastly, and most definitely not least, I want to talk about grief, because that's something that a lot of people don't talk about when we're talking about major health and chronic health. So what we expect grief to look like is linear, right? But what we know is grief is all over the place. And it is no straight line to grief. We usually discuss it in the context of death and dying, or those that we may be leaving behind. But I ask you to consider that the process also occurs with the living. Patients with chronic illness like lupus and their families will not return to the same normal that they had before the diagnosis. And there's a mourning period for the lives that they had, and then a mourning period for what's to come, what's projected. And it's a tricky and sticky situation, but it's one that needs to be had. So we've heard of the 5 stages of grief. And there's also come out with some, the 7 stages of grief. I present to you, there may be 9 stages of grief. There is a lot of research out that says that there are 9 stages of grief, and that none of these are in any particular order. But, you have shock and, what is this and what's going on? And then there's a disorder of your thoughts and your feelings after being in denial. When you're trying to settle in and try to figure out, what's really going on with me. Then, there's pain, then there's anger, because your pain turns to anger. And it's not uncommon to feel angry towards, yourself, towards, the doctors, mad with your body for it not performing like you want it to perform. Guilt and bargaining is, whatever higher power that you're talking to, if this will go away, then I will fill in the blank. Physical and emotional distress is when you're just trying to process it and what's going on with you. And then, of course, there's just plain old depression, where you just kind of you sit there and you're sad about what's happening to you, because you start to realize that there's really nothing that you can do about it. And then, of course, there's loss and loneliness. You're mourning the loss of what you used to be. Then you're withdrawing from your social activities or from your family, sometimes even from yourself. And then there's a period where you come to acceptance of what's going on. But there's no set time for any of these stages. There's no set order. It's just, it has to happen. And when you have patients that are dealing with these things, I present to you that you be flexible in allowing them to ebb and flow through these, through the stages. So this is another model. I put 2 up here because I like the model on my right, which I feel like it's like, it's the highway instead of like squibbly stuff. It's kind of like going to Atlanta or driving in LA. You kind of get off here, and if you get off on the wrong place, you got to turn around and you may go back to the same stage of grief again. Doesn't mean that you'll be going around in circles forever, but does mean that it may take a little longer to get to where you inevitably will end up. So I present to everybody, and even to myself, to learn to dance in the rain. Anxiety and grief and depression related to lupus is a process, and it's chaotic. There are highs and lows, ebbs and flows. There's no real answer. Even for therapists out there that are trying to figure out how can they work with their patients, I say walk alongside them. I think of the movie Cars, where you remember there was a whole bunch of bumpy road, and then when they smoothed the road out, they were just gliding along. I suggest that you glide along with your patients and just roll with them. There may be times where things may trigger something that's going on with your patient, and that's not, I wouldn't see that as a setback. I see that as a come up and a situation where that person can learn, and you as a clinician can learn, and teach the patient how to face their loss and to come up with a new normal. And then this is a time to talk about self-care and what self-care looks like and what it truly looks like. That looks like taking a bath, combing your hair, exercising, eating some good food, and being mindful. And that's one of the things that works well with a lot of lupus patients and autoimmune patients in general, is to spend 15 minutes just relaxing. They talk to us a lot about taking naps and taking breaks just in case, so that you can get through the rest of your day. To journal, create routines and structure, so you kind of know what's ahead, and so you can kind of budget your energy level for that. And here's one of my favorites. It's something that we use in the lupus world. We call it, do you have enough spoons for today? So, you may, and most of us start out with a fictional 12 spoons for the day. Well, you have to go to work, you got to pick the kids up, you may have to clean, cook. There may be a lot of things that are involved. So if you only have 12 spoons for the day, you have to budget your spoons, because once you're out of spoons, you're out. So what the main goal of that is to do the things that are most important to you, and then to use your time wisely to do other things. Learning stress management techniques can help with this, educating yourself and educating your patients on autoimmune, and especially with lupus, and what that means. Because sometimes getting out of the bed, it takes 5 spoons sometimes. And sometimes taking a bath takes 7 spoons. It just all depends on what your day looks like. So talk to you a little bit about the Lupus Foundation of America. And Lupus Foundation of America works to on the basis of getting lupus patients back to a new normal, and that one day that there will be a cure for lupus, and they are definitely working with researchers on that right now. So the pillars are research, education, and advocacy, to make sure that all communities, especially those that are affected by lupus, know as much as possible about lupus, and then have accurate information so that they can use that to go into their primary care offices and get the correct diagnosis and the correct referral, so that they can see someone like a rheumatologist. So usually what happens is you see your primary care physician, but they refer you on to a specialist. So a specialist that usually deals with rheumatic diseases is a rheumatologist. And I see a awesome rheumatologist at UAB, and they are on the forefront of doing a lot of research for lupus patients. The organization's goals are built on strategic outcomes that are disease specific and patient centered. So they do everything that they can to support the patient as a whole, mind, body, and spirit. And then they're attacking lupus from all different angles. They're looking at investing millions of dollars into clinical trials, and to the All of Us project, which I'm not, this is not I'm not saying you should go use the All of Us project, but they're using it to map human genome and to look at what specific genetic markers make people susceptible to the lupus diagnosis. Okay, and so we'll talk about some programs. Because lupus is difficult to treat and manage, LFA has developed a new program called SELF, and it talks about managing lupus symptoms, managing stress, managing medications, because as I mentioned before, I was taking 20 medications, and the average is 8. I even had to give myself chemotherapy shots and had to go to the cancer center to receive chemotherapy infusions. And sometimes that can be a lot. You can work with your rheumatologist and your pharmacologist to try to figure out medication interactions. And then you can work with your social workers, clinical social workers, to figure out what works best. And what usually is what they're talking about is what medications you should take together and what medications you should not take together. For instance, there are certain, if you have a blood disorder, you should not take citrus juice like orange juice, any type of pineapple juice, any type of citrusy type juice. You shouldn't take that with some type of medications. And in some instances, they would suggest that you not eat any greens. So, people in the South, collard greens, mustard greens, kale, you probably should space those things apart. Doesn't mean that you shouldn't eat it or you can't eat it, that they should be spaced apart from certain medications. So that's kind of what the SELF program helps patients understand and get into the mind and routine of. Then we have some awesome certified health education specialists that you can call and you can refer your patients to. and they will answer all types of questions. I asked questions before I had surgery just to make sure that I was cleared. Not only did I talk with my medical team, but if I was a little nervous about, a certain medication that they may give me or a certain medication that I was taking, and, maybe they said, hey, you should come off of this medicine. The worrier in me said, well, let me call LFA and ask them if it's okay, if that makes sense, the regimen makes sense, or coming off this medicine won't flare my lupus, or having this particular surgery during a lupus flare that won't, make me come out on the other side in a worse situation, for example. We have other national resources. There's a website with a plethora of information that is available to everybody to use to be able to get your patients to the right people. There's a list of rheumatologists, what they specialize in. Like, for instance, rheumatologists can deal with any type of manifestations of lupus, but even within specialties, there are people that specialize in, something more specific, like maybe joints and connective tissue, or maybe knees and carpal tunnel or something like that. Okay, so other programs out there is an expert series that's a monthly educational podcast. There are 150 support groups that are out there. And then there's a joint Lupus Connect that's online. And there's a LFA Facebook group that's very active that people can join, even if you are a provider, to ask a couple of questions, because there are people in there all the time that are just itching and have an open heart to answer any questions that providers or parents or anyone has about lupus, or how to navigate the system. So here's just a couple of pictures of what some of our group leaders look like. We have group leaders in Florida, Alabama, Tennessee, Texas, Kentucky, but you can drop in on any of them depending on what your availability looks like. And, they're in different time zones. And that's why I said, depending on what your availability looks like. So to get involved, they want you to donate, of course. I think all organizations want you to do that. Sign up for their newsletter. If you can spare the space in your Yahoo or your Gmail. And then also there is a walk for lupus that I have been going with some of my great girlfriends and family members who have supported me throughout this whole entire situation. And we make a big thing of it. Like, one year, my two best friends made cupcakes, and they were giving out cupcakes, and we were blasting music, and we were walking, and it's a great time to have. And although all the walks are done for this year, there will be a walk next year. And I'm safe in saying, and I think I'm very secure in saying, that myself and my two best friends will be there in full effect, because they missed us in the last couple of years. A couple of people have been asking if we're going to come back. And I would love for you all to join in and have fun with us. All right, y'all. I talked enough. Are there any questions?
I will start with questions unless I've interrupted somebody. Was someone speaking? No. So I have several questions. One, what is the latest in life one can be diagnosed with lupus?
From what I was told, and from what I've read from peer-reviewed articles and talking with even my rheumatologist, you can be diagnosed with lupus up until your date of death.
My goodness. Barbara Powell is asking us, can you get lupus genetically from a paternal grandmother?
Yes, you can. Lupus can pass through your genome from maternal or paternal ancestors. Like I said, I have 15 brothers, and I'm one of 16. I am the only girl. Oh. And I'm the only one with lupus. But I do have some great aunts that have the diagnosis, and some other aunts and uncles twice removed, 3 times removed that probably had the same issues, but never were diagnosed the way that I was.
Ms. Turner wants to know if we might receive a copy of this from you.
Yes, you can.
If you'll send it to me, I'll print it and send it out with the certificates. Ms. Williams is asking, how would those with lupus like to be supported by family members?
Understanding. I think that would be definitely one of the one things that I would say is understanding, because usually what people say is, well, you don't look sick. Like right now, like, would you say I look sick? I think I got good lighting, but
You
I'm
got
in a
great
lupus.
lighting. You look good.
Yeah. I'm in a flare today. I would say understanding. Yeah, I'm in a flare today. My hands are swollen, my elbows are swollen, my knees are swollen. Neither here nor there for you, but I'm making that distinction to say that most patients want you to be patient with them. We understand that we're moving slow. We understand that we look fine. We understand that we have a little persnippety attitude a little bit, but understand that we're not upset with you. We're upset with us, because my body used to do these things, right? Like, I'm a part of a sorority. Like, I used to like jump in the air and flip it around and toss things in the air and catch it. Like, you know, I used to be able to throw my child up in the air and catch her and spin around and, you know, do the latest dance crazes. I'm upset with myself. Like, it takes me a while to get in my Tahoe. My husband has an Armada. It takes me a long time to get in the Armada. And he's looking at me like, any day now. And I'm like, I know, any day now we're gonna go. But he's very patient. So we're frustrated with ourselves, because we know in our minds we're anticipating that we're slowing you down. We're a burden to you. You have to wait on us. Like, we could have been out of the house 40 minutes ago if I didn't have to find my medicine bag. This is my medicine bag. I can't believe I'm gonna show y'all this. This is my medicine bag.
Oh my God. Oh,
I never leave home without this. If I leave home without this bag, we're going back. There's no situation where I will leave my house and not take this bag with me. None. There's none. My house can be on fire. I will take my cell phone, this bag, and my children, but this bag must come with me everywhere. I don't leave home without it.
Dr. Brown, Ms. Powell is asking, is there a specific test to diagnose lupus?
There are several. Doctors use patients' self-disclosures. They use physical exams. They also use a series of blood testing. Usually when you go to your primary care physician, they're going to do some preliminary testing. I want to explain that, because sometimes there's a disconnect in what primary care physicians do, and people get a little upset because then they send them to specialists. The way the insurance works is your primary care physician is authorized and can run any test that they want to. And with their ICD-10 codes, and there are only a certain amount of codes that they will be paid for if they run. So that's the reason for having specialists. Specialists can run a gamut of testing for you that primary care physicians may not be paid for, but that will be paid for by a specialist if that makes sense to you. And if you don't, then please let me know so I can back it up and explain that to you. But that's why they send you out to the specialist, because usually your primary care does like a RBC and a red blood. They do a red blood cell, a white blood cell. They look at your kidney function. They look at, your heart enzymes. But if you have something elevated, then they're always elevated, and they, you give them their urine sample. But if there's some things that are elevated, they may tell you come back and they run it again. And if they run it again, they kind of hit a glass ceiling of some sorts. So then they send you out to a specialist. Now, a specialist, say for instance, with me and kidney issues, specialist is going to run all different. They want to know if the kidney, if your blood vessels are dilated. They can run all different types of things to tell how your kidneys are functioning, how they empty, how the water comes in, how the water goes out, if there's not any water coming out, whether the particles that are in the water. So there are more specific diagnostic tests that specialists run that primary care physicians can sometimes do not get paid for. So they send those to specialists so that, insurance companies can pay for those. And I really hope that I answered your question. But mostly there are going to be those blood testings. Those ANA tests is one that is specific to in the inflammation markers. They want to know, are your kidneys inflamed? Is your blood inflamed? Are your blood vessels inflamed? They want to know, is there a genetic marker that's kind of blinking out saying, hey, I'm activated. And to be clear, you can have a positive ANA and not have all the lupus markers and still have lupus because you have all the physical manifestations and symptoms. So seeing a rheumatologist or a specialist will be a great idea to get those nuances teased out.
Thank you. Patricia Ford is saying, you did such an excellent job. It is very difficult living with autoimmune disease. I have several, and they're being tested for lupus. Thank you for this. I feel so understood in this space and misunderstood outside of here.
Thank you.
And Ms. McIntosh, Kiana says, thank you for your transparency. My best friend was recently diagnosed. This is so helpful. Thank you so much.
You're
Angel
welcome.
Phillips is saying, awesome job. I'm so proud of all you have accomplished. Stephanie Durzis says, did I miss the password? Thank you, Stephanie. You are always someone I count on to remind me when I forget. So thank you for serving in that role. And I've allowed Dr. Brown to choose our password and to give it out. So if you will, Dr. Brown.
Okay, thank you. I am the owner of Compass Rose Behavioral Health here in Tuscaloosa. And so your password today is Compass Rose. It's all one word, and you're going to spell it COMPASSROSE.
And that's with a capital C and a capital R, Compass Rose, one word, no space. That's the password. Thank you, Stephanie, for reminding us. Ms. Jackson says, this was very helpful information, as I had a friend many years ago who died from lupus. You are super.
Thank you.
Compass Rose, Ms. Powell put it in. Thank you, Ms. Powell, for putting that in the chat room for those who can see it. And then I have many questions. One, is there any symptom, I guess, of lupus in which the palms of the hands would be affected?
Yes, I've had rashes. I could pull up stuff. I've had all kinds of weird stuff pop up on the palms of my hands, and I'll call a friend over and go, "Hey, just so I'm not tripping. Do you see this? Can somebody take a picture of this?" And then we get a ruler out so they can see. Because usually, let me tell you, for any of you patients, for any clinicians, anybody working with patients, sometimes what happens, and this happens to you too, you call the doctor, you make your appointment, something's wrong, there's a growth, I want to know what it is, they can't see me today, dang it, okay? This is what happens. Then you go to the appointment and the daggone thing is gone. Now they think you're lying, you're a little, something's wrong with you up there. So this is what you do. You take a picture and you get a ruler. I'm telling you, get a ruler, if it's the size of a dime, a quarter, whatever it is, take pictures, take pictures of it and show y'all. I'm such a loopy. I have these things everywhere. And you put it there. It's like, hey, it's this size. It's this color, right? And so even though it's not there anymore, you can take those to your doctor and they will accept those in as evidence that you're not losing it and it did happen, but that it has subsided. And then you can tell them what you used on it, And sometimes I'm telling you, I've told my doctor I've used things and I'm like, you might not want to write that down, but I use such and such. And he's like, yeah, I'm still gonna write it down, but don't do that again. I'm like, if it worked, it worked.
Well, that's good to know. And then Ashley Talbert is saying, I have been diagnosed with lupus. I experience Raynaud's every so often.
Hey, me too. My fingers aren't purple today, but my shirt is.
The reason I was asking these questions, and we spoke before the presentation. My daughter has some of these same presentations, the rash on her palm, aches, loss of hair. And then the other question I had for you was, we were told many years ago when my daughter first started sort of having a personality change that it may be lupus. Is that consistent with the onset of lupus? She became a different person, and the person who was working with as a friend, Dr. David Kimberlin at Children's, had told us that he was afraid she may have lupus.
I'm going to say yes. Yes. Personality changes, because I'm just going back. Sorry, y'all. I was just trying to find something a little more aesthetically pleasing for you to look at. You probably don't want to look at that, but yes, to answer your question, because lupus affects your anything is fair game in may your odds forever be in your favor. Everything is fair game, right? So yes, you can have personality changes, because you gotta think about it. If lupus is attacking your brain stem, and I sometimes have to remind some of my friends and my loved ones when they're like, well, you're acting weird, or it's because the back of my neck is swollen. And when the back of my neck is swollen, that means my brain stem, and that means that your spinal column has inflammation in it, and it's pressing on nerves, it's pressing on that fluid. And those are part of the things that make your personality what it is. So if you don't have the synapses running like they're supposed to, things are not firing like they're supposed to, then that is going to change the amygdala in your brain, your medulla oblongata. That's an actual place, people. It is. And your frontal lobe, those things can change. And you think about it, if your brain is just a little bit slightly swollen in your skull, because it can't go anywhere. It can either come out your ears, out your nose, or something like that. Then there's going to be a change in how you feel and how you present yourself.
Thank you. Ms. Powell is saying, my granddaughter is currently going through testing. Her paternal grandmother had it. She is sick all the time and has many of the symptoms of lupus. She is going this week to a rheumatoid specialist. Not sure why, but maybe they can all figure it out.
That's usually that's the private eye right there. That the rheumatologist, the rheumatoid specialist, they are usually going to be the gumshoe. That's your Carmen Sandiego right there, is your rheumatologist. They specialize. Yeah, they specialize in rheumatic diseases.
And then you mentioned, and she thanks you. She says that's good to know. You mentioned that you found a great rheumatologist at UAB. Is that correct? Would you mind sharing that? I'd like to get my daughter in there and my wife.
Well, I will definitely share the name of my doctor. You can share him, but you can't have him. His name is Win Chatham. His name is Win Chatham. He is the head of rheumatology there at UAB School of Medicine, more specifically the School of Rheumatology. He's an awesome guy. He heads up their research department. He does a lot of things, research, and he also sees patients. And I'm glad that he took my case. At the time that he took my case, I was on a walker, taking no medication, in pain all the time. My hair was falling out. I was definitely in need of seeing him, and he got me back to a good state of homeostasis. He is also who I would call my second child's father, because we had a conversation at which we decided when it was okay for me to have a baby. And he was there for the birth of my son.
Oh, how sweet. Well, I just have to say, it looks like our questions have sort of run their course. I just want to thank you. This was courageous on your part. And not only was it an honor to have you speak, but to have you open up yourself for the purposes of others truly speaks to your character. And I'm in awe. And I thank you. I appreciate you being here today. I hope anyone who's listening will join us on Friday. We have LaTanya Washington, a social worker, who will discuss self-care. We may step on some of the items that Dr. Brown would like us to know about self-care, whether we are suffering from an autoimmune disease or where we're maybe a clinician who's suffering a secondary trauma from serving patients with autoimmune diseases. That's what we'll discuss on Friday. I hope you'll join us then. But again, I want to thank you all for being here, and thank especially Dr. Brown. And she had asked me prior to starting if I might want her to do other presentations after I see how she does today. And the answer is absolutely yes, of course. Your choice. We'd love to have you. And we all thank you for a wonderful, wonderful CEU and contact hour. And is there anything you'd like to say in closing?
I want to say thank you for allowing me to share my passion, to share information about lupus, and then to share my passion about being a clinician and mental health. Those of you that have family members or have questions, please reach out to me. I'm thinking about doing a support group. So it may be something that comes out of this. But in all, I just want to thank you for your time. I know that you could be doing things. You could be at Chipotle right now. Thank you for spending your time with me. I really appreciate it.
Well, we thank you, and we look forward to having you back again at your leisure and your pleasure. Thank y'all for today. Have a great week, y'all, and happy early Merry Christmas and Happy New Year. And thank you all. I'll be sending out, when you all receive your certificates, Dr. Brown will be copied. So if you had something personal that you want to address, just know that you'll have a means to do so. And otherwise, all of you have a terrific day. Thank you so much.